Right. So I was asked to give a talk on the medical management of fatigue, what medications might work for it. It's important to state that fatigue is a very common complaint in people with multiple sclerosis, probably affecting 80% or more of people with MS, and many people with MS rate it as one of their top complaints as well, so they find it disabling. So the question is, does medication help? And there are many different medications that have been tried. I reviewed the literature on medications such as amantadine, methylphenidate, modafinil, some of the amphetamines, and then some unusual drugs like salbutamol, the asthma drug, and famotidine, the medication used to help walking in people with MS. The bottom line is there's no hard evidence to suggest that any of these medications are more effective than placebo, which is disappointing for people with MS because they're looking obviously for a tablet that might be able to help them. Probably the best study in the literature was a publication that came out in the Lancet Neurology a few years back, in which they looked at modafinil, methylphenidate, amantadine, and placebo. A very carefully designed study. They ensured that the dosage regime was correct, that the duration of treatment was correct, and at the end of the day, they found no difference, no benefit over placebo. So it's very clear that there's a strong placebo effect when it comes to treating fatigue, and that's not unusual, not unexpected. You see a strong placebo effect in many parts of medicine, but we're still waiting for the medication of choice that might help people with MS. So practically, what do you do then if you've got someone with fatigue, a patient with fatigue? I didn't review this literature, but there's evidence to suggest that cognitive behavior therapy is probably the treatment of choice. There's also some reasonable data to show that mindfulness therapy can help with fatigue. There is a really interesting study, the results of which are awaited shortly, looking at modafinil on its own versus cognitive behavior therapy on its own versus modafinil plus CBT. The protocol paper has been published, but the results of the study are not yet out. I think it's going to be an intriguing result to look at. But from a practical point, when you've got a patient with fatigue, in my clinical practice, I still use some of these medications because it's important to remember that the drug studies are group findings, that embedded within these groups are individuals who may well respond to one of these medications. And indeed, if they do respond, you're not too sure, are they responding to the medication or is it a placebo effect? But the same can be said for lots of drugs in medicine. Depression being a very good example. There's a very high placebo response to antidepressant medication. So when your patient's depression gets better, are they responding to the medication or to the placebo? So we face this dilemma all the time in clinical medicine. But I find that in my clinical practice, I still use some of these medications to help patients who, anecdotally, tell me that they find the medication helpful. But the bottom line is when you have a very close look at the literature and review it thoroughly, there's no evidence to suggest that any one of these drugs outperforms placebo. When it comes to managing fatigue, you want to rule out the secondary causes of fatigue. So it's very important that you take a detailed history. You want to make sure that the fatigue isn't coming because there are sleep problems, for example, sleep apnea, or they don't have another medical problem, hypothyroidism, for example, or not the product of anemia, which can cause fatigue. You want to have a look at things like body mass index. If a person is grossly overweight, that can cause fatigue as well. Is it going to be the side effects of medication that they're taking? We know that many people with MS who've got pain take medications in which the side effect is sedation. And so you want to check the medication list. So that, there are many things that you can do to rule out secondary causes of fatigue. And if they're present, you treat them or you eliminate them. Depression, for example, is closely linked to fatigue. So you want to make sure your patient's not depressed. And if they are depressed, treat depression. But at the end of the day, when you've ruled out all these secondary causes, depression, other medical causes, side effects of drugs, etc., and you end up with this core symptom of fatigue, that's difficult to treat. And that doesn't respond to the medications that I mentioned in a more effective way than placebo. But CBT seems to give an improvement, moderate effect size. Mindfulness also approaching a moderate effect size. If you don't have access to CBT, that's obviously a challenge as well. And then, maybe cautiously trying some of these medications might be helpful. As I say, individuals do respond. The data that I've summarized for you are group data, and embedded within group data are going to be some individuals who might respond to these medications.